Hey, welcome to Ergo Everything, where we discuss RSI solutions for computer users. Today, I'm going to show you how I massage my neck muscles using trigger point massage from this book, the Trigger Point Therapy Workbook by Clair Davies. And I use a Sharpie so that it doesn't kill my hands, which is very easy to do, even with like the correct hand techniques. So before we dive in, I do just want to say that massaging the neck, especially the front, is considered kind of dangerous because there are so many blood vessels and so many nerves that run through that area. I'm not a professional. I could be doing this wrong, so I want you to know that I would actually just recommend getting the book yourself, but the book doesn't have any tips about how to massage with a Sharpie, so that's kind of what I'm hoping to add to the scenario. Where there are risks that I know about, I will try to make you aware of those, but just know, do proceed at your own risk. Now, I think it's very important to massage the scalene muscles. That is how I basically got rid of my ulnar nerve pain, which I think is super awesome. And they are very important because the nerves and blood vessels that run to your arm and supply your entire arm pass through those muscles. And when you have poor posture, you can create trigger points and tightness in those muscles, and they can squeeze together as well as pull the first rib up closer to the clavicle, which is the space those blood vessels and nerves run through, and then end up just putting pressure on the blood and nerves. And it's not great. So let's get started. So the first muscle I massage is the sternocleidomastoid. And you can easily see it by bending or turning your head one direction, and it really likes to stick out. This muscle is really great because it kind of acts as a landmark and helps you navigate the rest of the neck. Before we massage this muscle, I do want to say that there is a concern about massaging this muscle because it is so close to the carotid artery. That artery is medial to the sternocleidomastoid, so runs roughly here and here. And the concern is that if you accidentally kind of push on the artery as you're massaging this muscle and you have plaque in your arteries, it could loosen up that plaque, and then that plaque could come off in a chunk and go up to your brain and cause a stroke, basically. Now, if you are healthy, your arteries are not covered in plaque, and that's not a concern at all. But if you have any indicators of heart disease, like high blood pressure or anything like that, maybe this is something you need to worry about. Maybe you want to talk to your doctor first. Personally, I've never pressed harder on that artery than you would to take your pulse, for example. But that is something that's mentioned in the book, so I want to mention it here. All right, so with that out of the way, this is how I do it. So basically, for most of the neck, I do use a Sharpie. For part of the sternocleidomastoid, you really do have to pinch, but it's not for very long. So what I do really to reach this muscle, I feel like I have to turn my head, and then I can grab it. Usually the lower down, the easier it is for me. And then once I have grabbed it, then I turn my head forward so the muscle is more relaxed. Now, initially, I thought that I really needed to pinch this muscle and move like this, and that tires out your hand. I also was just pinching way too hard, but really, you just need to kind of try to create a gentle pinch, which I know sounds weird, but see if you can tap into that. And then once you have the gentle pinch, you're then gonna use your whole arm to just kind of pull in and out as opposed to using the finger specifically. And really you're just looking for any spot that really hurts, and then you're going to kind of rub over that spot. So I'm get it, reset, get it. And you can do that up to 12 times. And then I will just turn my head again, grab another spot a little higher up, and we can just do the same thing. And I'll just do it on kind of the other one, just in case that's a better angle for you. And you are close to your larynx. I don't think you can hurt it, but If you feel weird and like you can't talk, that's probably why. And you can go all the way up. This muscle runs all the way from the sternum up to the back of the skull. So you can go all the way up. Now, the higher you get to the skull, the harder I feel like it is to massage with your hands. So at some point, I will switch over to the pen. So to use the pen, up high, I'm kind of just palpating to feel where that muscle is going to. And then I push on the muscle and find a painful spot. And then I'm going to take my pen. I'm going to place it over that painful spot. And then I'm going to take one hand and apply pressure. And then the other hand I just use to gently guide the tip of the pen back and forth. So we're going to apply pressure and guide the tip. And we'll just go over that spot, go over it up to 12 times. And then we'll find a new spot. Now, I, of course, am not doing this very thoroughly. It's just as a demonstration. I would actually spend quite a bit of time with this. All right, and you can see I'm getting some red spots from where I was pinching. That's normal. All right, now from here, we're gonna go to the other leg of the sternocleidomastoid, the part that connects to the clavicle. And I really think it's easiest just to think of this as a separate muscle. So we're gonna go down to our collarbone and just feel that collarbone for yourself so you know where it's at. It's also an important landmark. So we're gonna find kind of the base of that muscle we just massaged. And then if you go over a little bit, there's an empty space. There's just not really anything there. And then if you keep going over, you will feel another muscle. And I found that muscle. And then this one, we're just going to do the same technique. Put the pen there, and then just try to get some good angles for you so you can kind of see what I'm doing. This is very much about palpating though. It's really hard to like see these muscles like you could maybe other parts of the body. And then we're gonna just keep going up. And this muscle kind of just goes under the muscle we just massaged. So we're just gonna keep going up as high as we can. And anytime you find a spot that's painful, initially for me, that was everywhere. I just had trigger points literally everywhere. And you're gonna massage them. And right now, I can feel something kind of bony that I'm pushing against. It's literally my cervical vertebrae, or the transverse process anyways. And that really freaked me out when I first realized that, but now I understand how my neck works. And so I just kind of like lost track of where it is. So I'm gonna redo kind of my orientation, find that muscle, go over until we find the next muscle, and then we can just kind of work up, figure out where we left off. And if this takes you more time and feels kind of confusing, it was pretty confusing for me at first too. So, now to find the anterior scalene.
Scalene is anterior. The one is here, and the other is just as it peeks out from underneath the sternocleidomastoid muscle.
Okay, so now we're going to massage the anterior scalene. From this picture, you can see that it is just behind the muscle we just massaged. And so what we're going to do is we're going to find that muscle again. And the sternocleidomastoid is very like superficial. The scalenes are kind of deep, and they don't feel as squishy. So basically, once I find that muscle, I'm going to slide just off of it, and that's when I know I've hit the anterior scalene. Now, the scalene muscles, they hurt different. They create almost like a spooky kind of feeling. And they often, so trigger points often create a referred pain point. So pain that's like kind of far away from the spot that actually has the trigger point. And scalenes are very, very likely to do that. So if you're like massaging a scalene and you suddenly start feeling like kind of like a weird aching in the side of your head or your shoulder blade or a part of your arm or like a part of your chest, that's pretty normal. It's a really weird experience. Kind of cool though. All right, so I found that scalene. And here you probably want to be more careful with the Sharpie because you are getting closer to the brachial plexus or nerve plexus. And I'm just not finding any spots that like hurt yet, so I'm just kind of going up. There's one. Okay, so again, and here I'm actually being more gentle than I was before just because of the spot I'm in. But we're just pulling it past, no biggie. And yeah, it's just a weird, spooky feeling. All right, so I get up to a certain point where I feel like I kind of have to like push the sternocleidomastoid out of the way to massage this. So one technique for massaging the anterior scalene, which I don't know that I fully understand, but it's taking the sternocleidomastoid, kind of shoving it towards your vocal cords, and then just trying to massage like directly under that. And I'm sorry I can't really be more specific with a lot of these. Again, I feel like you really got to get the book. All right, so once I've kind of gone up and massaged the anterior scalene, I just kind of find like another muscle that's kind of on like the side of my neck. And then I just go down, and I'm always pretty sure that that's the middle scalene. And I will just go down to the collarbone. I don't like to try to dig under the collarbone and massage under there because I feel like that is where the brachial plexus is. So, but I will go down to the collarbone. Yeah, this middle scalene has lots of trigger points for me. I'm not going to massage them all. But yeah, and then it comes down, and once I get right above the clavicle, that always seems like a really good spot for me. Now, the posterior scalene, so the other muscles, they kind of run up and down. The posterior scalene runs more horizontal. So to find the posterior scalene, you also need to like find the traps. So, you know, this part right here, the edge, that's definitely the traps. But then if you kind of come over the traps and where you feel that end, the muscle is like it lies right under that trap. So we can just take a Sharpie and do same thing. Yep, hurts a lot. It's a good spot. Honestly, Sometimes I end up like kind of yelping or moaning when I do this. It can be pretty painful, the scalenes. Um, and don't worry too much about like, am I getting the exact right muscle? Because if it hurts, then you're getting some trigger point. And then you can also kind of go into the traps themselves. And I find often this is easier to do when laying down, actually, because right now I'm having to lift up my arms, and my arms themselves are kind of fighting gravity. So if you lay down, then your arms are no longer, like the top of your arms are no longer fighting gravity. You're really just using like the tricep to fight gravity because you're laying down. All right, so just to demonstrate what I mean, and so you can see every single angle of my room, this is what I mean with the laying down. When I massage like this, my forearms, which are the weak part, which struggle, they just kind of get to dangle there. They're just dangling. And that really, really helps. It makes this so easy. It's hard to explain. And with the back of my neck, I don't really like worry too much about finding any specific muscles. I just kind of stick the Sharpie in there. And I'm just doing a weird thing with my arm to try to show you, maybe. Maybe, I don't know. But I just kind of like dig in there. Obviously, don't massage like right on the spine, but all around it seems great for me. And yeah, just do it laying down. Once you get to like kind of past the side of your neck, consider doing it laying down. Alright, so massaging the traps with that Sharpie is a little bit difficult. I would say that's the thing that is the most intense on the hands, just because it's such a meaty muscle as opposed to all the other really small neck muscles. So I have another option. Just so you know, for me at least, using a massage cane is even worse than using the Sharpie, but if I really want to be extra careful with my hands, here's another thing I've come up with. It's not like super accessible because it requires a treadmill. This is the arm of a treadmill. Maybe you can find something else in your life. Maybe you can find some overhanging wall or something. But this is another thing I've done, which it's pretty awkward. But I just kind of like get my shoulder under there, have the ball under there, and rock around, and you know, my legs get a good workout because it's just like an awkward crouchy thing. But it works, and these muscles usually need, the upper traps usually need a lot of massaging because our arms get so hunched, and our upper traps usually get, as RSI sufferers, usually get like super strong, and our lower traps get super weak because our shoulder blades are far apart from each other. So don't massage the lower traps. Upper traps can be very useful for helping with posture. So that's all for now. Before I leave, I do want to mention that I've been having a lot of issues with my voice. So even though I have so many ideas of things I want to discuss on this brand new channel, things may be either super slow, or I may be taking a super long break until I can properly figure out what's going on with my voice. But I do have a few videos that I need to just edit and post, so that'll be coming out, a couple of videos there. But yeah, wish me luck, and I wish you luck, and hope the neck massage helps you.